Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What causes constant nausea and how is it treated? Chronic nausea occurs when queasiness is constant or comes and goes for several days or more. It can be a symptom of a number of health conditions, like peptic ulcer disease or gastroesophageal reflux disease, GERD. Chronic nausea, known as morning sickness, is also common during pregnancy. /r/n/r/n Constantly feeling nauseated is different from acute nausea, which is what you may feel suddenly during a viral or bacterial infection or when you have motion sickness. /r/n/r/n This article explains the causes of chronic nausea and other symptoms that might accompany an underlying issue. It discusses when to see a healthcare provider and possible treatments. /r/n/r/n Chronic or constant nausea is defined as feeling nauseated for 4 weeks or more. Often the sensation comes and goes and the intensity varies, but the relief doesn't last and the nausea constantly returns. /r/n/r/n While you may feel like you're going to throw up, you may actually never vomit when you have chronic nausea. In situations when vomiting does occur, it could cause dehydration or other potential complications. /r/n/r/n Compared to chronic nausea, acute nausea is a short-term feeling. Unlike chronic nausea, which can be disabling and related to hard-to-manage medical conditions such as gastroparesis, acute nausea is usually relatively easy to manage or quickly resolves on its own. /r/n/r/n In some cases, chronic nausea may come on after a triggering factor, such as eating, only to improve and then come on again after the next meal. /r/n/r/n Chronic nausea is common in pregnancy. The nauseated feeling is called morning sickness even though it can last all day. While it can be difficult to deal with, morning sickness is not harmful to the baby. /r/n/r/n Often, nausea comes on in the middle of the first trimester and is gone by the second. But some people have nausea their entire pregnancy or it comes back towards the end. /r/n/r/n When nausea is severe and is accompanied by vomiting to the point where keeping any food or water down is challenging, this could be a condition called hyperemesis gravidarumThis Extreme, persistent nausea and vomiting can lead to weight loss, lightheadedness, and dehydration. /r/n/r/n Treatment involves antiemeticsantinausea medication, and hospitalization so fluids and nutrients can be administered intravenously. /r/n/r/n Gallbladder disease includes infections and blockages that affect the gallbladder, the digestive organ that releases bile to break down food. A common gallbladder issue that can nausea is gallstones. /r/n/r/n Gallstones are common, especially in women, who are twice as likely to have stones as men. Gallbladder stones might cause no symptoms but may also cause pain in the back, shoulder, or upper abdomen, and nausea and vomiting. /r/n/r/n Symptoms might be worse after eating, especially when eating a meal containing high levels of fat. Gallstones might be diagnosed with one of several different imaging tests and are most often treated with gallbladder removal. /r/n/r/n Gastroesophageal reflux disease is a common condition that occurs when stomach contents come back up into the esophagus. This can cause symptoms of heartburn, regurgitation, and nausea. Other symptoms may include the following. /r/n/r/n Symptoms might be worse after eating or at night after lying down. The nausea may linger, especially if stomach acid backs up into the throat. /r/n/r/n In many cases, GERD is treatable with over-the-counter or prescription medication, including antacids, histamine 2 receptor antagonists, H2-RAS, and proton pump inhibitors, PPIs. /r/n/r/n Lifestyle changes such as losing weight and sleeping with the head elevated, as well as avoiding potential triggers for symptoms, such as smoking, alcoholic beverages, coffee, chocolate, fatty foods, and fried foods, may also help. /r/n/r/n Gastroparesis, a disorder in which the nerves in the stomach are damaged or stop working, which causes the digestive system to take a long time to move food along. The delays in emptying the stomach lead to chronic nausea along with the following symptoms: /r/n/r/n Migraine headaches might cause nausea either before the headache comes on or during the headache. Diagnosing headaches can be complex because there are several different types of migraines that have different symptoms. Treatment may involve both lifestyle changes and medications. /r/n/r/n A peptic ulcer happens when there are sores in the stomach, small intestine, or esophagus. In most cases, peptic ulcers are caused by a bacteria called Helicobacter pylori H. pylori. Another cause of peptic ulcers is the use of non-steroidal anti-inflammatory medications, NSAIDs, such as ibuprofen, but this is not as common. /r/n/r/n Peptic ulcers often cause pain or discomfort, but may also cause nausea, vomiting, loss of appetite, weight loss, and feeling full after small meals. For ulcers caused by H. pylori, antibiotics will be prescribed, along with other medications to help alleviate symptoms. /r/n/r/n Conditions that affect the nervous system such as intracranial hemorrhage or infections may be associated with nausea. These conditions are serious and are usually accompanied by symptoms of confusion, dizziness, or changes in memory. /r/n/r/n If these symptoms occur and a hemorrhage or an infection like meningitis is suspected, seek medical attention right away. /r/n/r/n A hiatal hernia occurs when there is a weak point in the abdominal wall and the stomach pushes through it and up into the chest. Hernias may cause symptoms of reflux as well as pain or discomfort, and in some cases, there may also be nausea. /r/n/r/n Small hernias might not be noticeable, cause any symptoms, or even require treatment, but larger ones may require surgery. /r/n/r/n Inflammatory bowel disease, IBD, includes Crohn's disease, ulcerative colitis, and indeterminate colitis, which are diseases of the digestive tract. These diseases cause inflammation in various parts of the digestive system and can be associated with chronic nausea. /r/n/r/n In some cases, nausea might be an adverse effect of medications or be the result of a complication, such as a bowel obstruction. Treatment will depend on the cause of nausea and might also include effective treatment of the inflammation caused by the IBD. /r/n/r/n An obstruction is when the small or large intestine gets blocked. A blockage could be caused by one of several reasons, including scar tissue or a kink or twist in the intestine. /r/n/r/n Usually, the most prominent symptom of an intestinal obstruction is pain, but nausea and vomiting can also happen in some cases. Obstructions are common complications of IBD and Crohn's disease in particular, but they can happen to anyone. /r/n/r/n Obstructions can be a medical emergency, so it's important to get care right away when one is suspected. In most cases, obstructions can be treated in the hospital without surgery. /r/n/r/n The pancreas is an organ that releases enzymes for digestion into the stomach and hormones into the bloodstream. Pancreatitis occurs when the pancreas becomes inflamed, which can lead to symptoms of pain that get worse after eating, fever, nausea, and vomiting. Pancreatitis can be acute or chronic. /r/n/r/n Pancreatitis is rare and people who have the condition are often quite sick because it is a serious condition. Treatment will depend on what is causing pancreatitis. /r/n/r/n Anxiety disorders are mental health conditions in which someone experiences excessive fear and distress. Anxiety can cause physical as well as mental or emotional symptoms. /r/n/r/n Several types of anxiety disorders, including generalized anxiety disorder, cause chronic nausea and other digestive issues. Additional symptoms may include /r/n/r/n nausea that persists without a known cause is called idiopathic chronic nausea. In some cases, it might also be called functional nausea. This doesn't mean that there isn't a cause or that one won't become clear in the future. It simply means the reason for the nausea is not clear at the moment. /r/n/r/n A big part of chronic nausea treatment is addressing the underlying cause, if known. Treatment options that are specific to the causes covered in this article are described above. /r/n/r/n If you're experiencing nausea and vomiting, it's important to stay hydrated. /r/n/r/n The following strategies may also help ease persistent queasiness and help prevent vomiting, no matter the cause. /r/n/r/n Call your doctor if your nausea has lasted more than 1 week, if you might be pregnant, or if you've had vomiting or diarrhea for more than 24 hours. /r/n/r/n Talk to your healthcare provider before taking motion sickness medication, antihistamines, or antiemetics. /r/n/r/n Nausea isn't typically an emergency. But call a doctor right away in the case of /r/n/r/n Nausea is a non-specific symptom. It might be challenging to pin down exactly what's causing it. In many cases, related symptoms, such as pain, fever, or vomiting, can give a physician more insight into what might be causing your nausea. /r/n/r/n Be sure to share any such details with your healthcare provider. /r/n/r/n Chronic nausea can be caused by a variety of underlying conditions that result in constantly feeling like you're going to throw up. This sensation persists for 4 or more weeks. /r/n/r/n Having nausea that comes or goes or won't let up is a reason to schedule an appointment with a physician. When nausea is accompanied by red flag symptoms such as severe pain, vomiting, or blood in the vomit or stool, seek an evaluation right away. /r/n/r/n Common conditions that are associated with nausea might be treated in various ways, but strategies like eating ginger and deep breathing might also help you cope with nausea in the short term. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.